Hypertension. The learning outcomes of this presentation are that at the end of this session, you will be able to explain the classification of hypertension, describe types of blood pressure measurement, describe hypertension according to the type of measurement, and explain the steps in blood pressure measurement. The classification of hypertension is as primary hypertension or essential hypertension and secondary hypertension. Definitions. Primary hypertension. It is most likely due to the numerous genetic and combination of risk factors. Secondary hypertension. Hypertension due to a specific cause of increased blood pressure which may be treatable with an intervention specific to the cause. Resistant hypertension is blood pressure that remains above goal in spite of concurrent use of 3 antihypertensive agents of different classes. If tolerated, one of the 3 agents should be a diuretic, and all agents should be prescribed at maximum recommended antihypertensive doses. Types of blood pressure measurement. Home blood pressure measurement. Home blood pressure is the average of all blood pressure readings performed with a semi-automatic validated blood pressure monitor by the patient at home. Ambulatory blood pressure measurement. Ambulatory blood pressure measurement provides the average of blood pressure readings over a defined period, usually 24 hours on a routine day. However, the daytime averages can be sufficient for the diagnosis of hypertension in many instances. Definitions of hypertension according to clinic, home, and ambulatory blood pressure measurements. These can be identified in the following chart. Steps to be followed during blood pressure measurement. When using auscultatory methods, use phase 1 and V Korotkov sound to identify systolic blood pressure and diastolic blood pressure respectively. 2 blood pressure measurements should be recorded 1 to 2 minutes apart, and if there is a substantial difference between the 2 readings, a third blood pressure measurement should be taken. Record the average of the last 2 blood pressure measurements as the clinic blood pressure. Blood pressure should be measured in both upper arms. If there is a consistent and significant difference in blood pressure between the 2 arms, that is, greater than 10 mm mercury, the arm with the higher blood pressure reading should be used for subsequent measurements. If the difference is greater than 20 mm mercury, consider further investigation. Steps to be followed during blood pressure measurement. If the clinic blood pressure is 140 by 90 to 180 by 110 mm mercury, offer ambulatory blood pressure measurement or home blood pressure measurement to confirm the diagnosis if available. If the pulse is irregular, blood pressure should be measured using direct auscultation over the brachial artery. In older people, people with diabetes mellitus, or people with symptoms of orthostatic hypotension, blood pressure should be measured in a supine or seated position and 1 minute and 3 minutes after standing. The following shows the steps to be taken before and during the measurement of blood pressure. Please note that the individual's back is supported and the patient is asked not to talk during and between measurements. The cuff must fit arm size. Small, usual and large are the sizes. An arm should be bare and resting. Thank you.